Most of us go to the dentist or the doctor on a regular basis, but we often don't get the mental help or help with addiction we need until it's too late. CEO and founder of MindMD, Ari Hirt, is striving to change the way we think about mental health and addiction.
How do we really properly case manage and provide and make sure that our patients or anyone who needs access to addiction recovery or to mental health or in any kind of way, how do they access and who do they access in the moment of their biggest need, which many times isn't predictable and in most cases isn't really talked about or public and not really something you just look up on Google or on the yellow pages, which really until now has been the only way. We categorize ourselves in some ways as like an urgent care for mental health, which is true in that we want to address the needs in that moment of crisis. But really, in so many ways, we're also a concierge of information for mental health because, where do you go, not just for what you need today, but we are a place to come to just talk and access and understand what's available for you specifically, what's best for you.
Hunt says most people believe a 30 to 60-day treatment plan that removes the patient from their day-to-day lives is what's needed when treating addiction. But he says that's not always the case.
What's more needed is for them to stay in their environment, to deal with their problems and their pressures and their issues right there at home, but they just don't know where to begin and how to access it and do that.
Jessie, Martori, who is the president of strategic development, says as a society, we tend to look at mental health and addiction as highs and lows, but rarely address the in-between.
Problems with mental health and addiction escalate. And what happens is as they're escalating, they're too acute or in too much need for like a regular doctor or therapist, but they aren't yet needing a high level of care at an inpatient treatment center, but there's nobody in that middle space that can help them. And so with this plan and with MindMD, what we're able to do is take someone who's starting to go into a crisis. They can walk in, immediately be seen, start getting medication, see a therapist, have those interventions and de-escalation, and come up with a plan to keep them safe so that they don't end up needing to go into crisis mode and into a hospital.
The entire center provides a welcoming environment. Instead of feeling like you're in a doctor's office, you can speak to a therapist in rooms that feel more like a fancy living room or start outpatient detox in an isolation booth with a massage chair. And all this is accessible when you need it.
That we're an immediate place that they can come and get that care. They don't need an appointment. We don't want things to escalate. So just for them to know that we're a resource here and they're welcome to come in anytime.
MindMD is located at 8500 Wilshire Boulevard and opened Monday through Friday from 9 a.m. to 5 p.m. You can walk up anytime without an appointment or call the center at 833-646-3631. For Nightcast Media, I'm Jackie Ray.